Welcome once again to my channel. This is Lawson Oshapas, and today we are going to be talking about Pharmacology 101. Pharmacology 101. So what is pharmacology? Pharmacology, basically we are talking about drugs and their relation in the body. This concept is divided into two. We have the pharmacodynamics and the pharmacokinetics. Now we are going to take them one after the other. Let's start with the pharmacokinetics. When we talk about pharmacokinetics, what are we looking at? Pharmacokinetics basically is talking about what the body does to the drugs. So when you take in a drug, what does your body do to the drugs? How does the drug enter your body, and how does it get out through your body? What processes does it pass through in your body for it to be effectively utilized? So pharmacokinetics, we are looking at absorption, distribution, metabolism, and what? Excretion. Let's take it one after the other. When you take absorption basically is talking about the routes through which the drugs get into your body. We are looking at whether it is being injected or parenteral injection. So if you are looking at injection, we are looking at the intravenous injection, intramuscular injection, subcutaneous injection. And among these three injections, intravenous injection is the most quickest, and like most of the time, most drugs are done using intravenous injection. Then whether it is orally taken, so oral or enteral. Orally, that's enteral. We're looking at sublingual and other oral techniques. Then whether it is rectal, absorbed through the rectum, lungs, or transdermal, put under the skin. Some of them they transfuse under the skin, so that's what's called the transdermal. Then we move to distribution of the drugs. Now when we talk about distribution of drugs in the body, we are looking at the way the body gets medication throughout the body, and most of the time it is through the bloodstream, or it is by the help of the bloodstream. Okay, after that we move towards metabolism. Metabolism is, we are looking at how the body converts medications into less or more active form, how they are being converted into less or more active form. So these drugs, this activity basically occurs in the liver. Yeah, that's what we refer to liver as the first pass phenomenon, or the liver is primarily responsible for what? The metabolic activities of what drugs. Sometimes kidneys, glands, and what intestines also play a role in what metabolism. Their effect is what less known. Then the last part of what pharmacokinetics is what excretion. How the drugs are being excreted from the body, or are being taken out from the body. So, or how they are being filtered out of the body, and this is by the help of what? The kidney. Now under excretion, one key things we look at is the half-life of the drug. When we talk about the half-life of medication, what are we talking about? We are looking at how long it takes for half the medication or half of the medication to be eliminated in the body. How long it takes for half of a particular medication to be eliminated from the body, and that is what excretion, or the half-life. Now other excretory organs are the bowel or the exocrine gland. Now let's move to pharmacodynamics as the other concept and the other part of what pharmacology, pharmacodynamics. Now pharmacodynamics, basically we are looking at what the drug does to our body. what does the medicine that we have taken, what does it do to our body? So pharmacokinetics is about what our body do to the drug, but pharmacodynamics is what the drugs do to what our body. So in this type, we are looking at our 3 or 4 main concepts here. The first one is the dose-response relationship. How does a particular dose of medication, what effect does it have in an individual, and what effect does it have in a population of people? So we divide it into the graded dose response, that is what the effect is having in an individual, and then we have the correct dose response, which is the effect it has in the population. Then we move to the potency versus efficacy. When we are talking about the potency of a drug, we're looking at the amount of drug needed to produce a given effect. How much of a drug do we need to produce a particular effect in the body? That is what the potency of the drug. It does not affect the efficacy. Now when we look at the efficacy is about the maximum therapeutic effect of a drug, or the efficacy, which is also known as the intrinsic activity. We are looking at the maximum therapeutic effect of a drug, or the maximum therapeutic a drug can produce, regardless of what it does. If we don't take the dose of the drug into consideration, what effect can that medication have on our body? That is what efficacy. These two combine to help us understand the effects of drugs on our body, the potency and the efficacy. Let's move to the third concept, key concept in pharmacodynamics. We have the therapeutic index, TI, therapeutic index. Now when we talk about therapeutic index, what are we looking at? We are looking at the measure of drug safety. The measure of what? Drug safety. It has a chemical formula. It has a formula, not a chemical formula. It has a formula, which is therapeutic effect. TI is equal to what? Toxic dose in 50% of population all over effective dose in 50% of population. I'll take that again. Therapeutic index is equal to what? Toxic dose in 50% of our population all over what? Effective dose in what? 50% of our population. Now, if the therapeutic index is, let's say, high, taking into consideration, let's say 100, that means the drug is safe to use, or it's safer to be delivered or to be used. When the therapeutic index is what? Low, let's say 2 or 3, this kind of drugs, we realize that the dose of what? The effective and the toxic dose, they are very, very close. Effective and toxic dose are very, very close. So in this type of drugs, like, they are not kind of much recommended, because as much as it can help the individual, the same way it can cause harm to the individual. Example of such drugs are chemotherapy drugs, warfarin, and then digoxin. Example of such drugs are chemotherapy drugs, warfarin, and digoxin. Thank you very much. Okay, another key concept in pharmacodynamics is what? Mechanism of action, how the drug works, whether it is enzyme inhibition, ion channel blockade, transport inhibition, or non-specific interaction. We'll talk about some of this in our next video. Make sure you like, comment, and share for more video or more content on